All right, friends. So it's great having all of you here. Though there were many more who'd promised, but I'm sure, they'll look at the recording or they'll be joining us in some time. So, friends, I'd like to introduce myself. I have just got a brief introduction about you all. And I guess all of you all are interested in working with children from some perspective or the other. I'm Kirti Bakshi. I'm a psychotherapist and I am in this industry for 25 years. In fact, I started off after I did my MSc psychotherapy, I started off working with children. And for 10 years, I did a lot of work with children, which started with behavior theater. Then it went on to, I had a full-fledged remedial center where I was working with children who were slow learners, children who were having social academic issues, emotional issues, as well as learning disabilities. So I had a staff of 5 teachers with me, and we had 40 children. And we did that for 8 years, and we were the earliest in the market. And we did that for 8 years, following which the school started their own remedial cells. And we thought, there's enough that the schools are doing right now. So we moved on to the adult counseling, which was also a part of my work already. So what I realized working with 10 years, 15 years with children is that the influences that today's culture has on children is very different. So we are literally dealing every 5 years with a new generation, and we are dealing with them in a new neurological wiring, which means a millennial child born in the 90s has a different personality than those born after 93, than those born now, Gen Z, and those babies who are born now called Alpha. So millennials, Gen Z, Alpha, all these children have different personalities because of the various influences that are happening today. There is a lot of disparity in our understanding. We might tend to understand these children with perspective from our childhood, but some of it may carry forward and apply, but not all of it carries forward. Everything is so different in today's time and date. The influences, the demands on children are so different. That is the reason child psychology and play therapy has become a crucial subject, whether you're a parent or you're a tuition teacher or a teacher or working with children. It is something which by itself is a separate vertical, and there is so much need because children are coming from a lot of electronic influences, which means there are lots of characters in their head. They are coming from lots and lots of materialistic influences. There is a peer pressure, there's academic pressure, as well as they have their own personality types. So now what really happens is that we are doing our best with our positive intentions to bring out the best from our child. And I realized that when I was working with children, every parent unanimously had so much love to give, had so much aspiration for their children. And every parent literally told me, my child is very talented, but they are suffering from probably a peer group rejection or a social issue, or probably, they don't want to study, or they have all kinds of problems when they sit down to study, and everything else was going on. So I realized that the need for the parents to be aware of what's going on is very, very, very important. So I started working with children, and I realized that it was so important for everybody to be aware. Just give me a moment. One. Yeah. So now I started working with children, and I realized that the language that you and me speak is very different, and the language that children understand is very different. So once I happened to work with a very young child who was basically, suddenly wakes up one day and says that I feel like taking a rope. I feel like tying both my parents on that rope, and I feel like swinging them out. And the parents were really, really surprised because that kind of language, that kind of culture had never ever been spoken to and within the family. So they did bring the child to me and we did play therapy exercises in which there is a way that the child will express themselves very well. So we have a technique called fantasy questioning. So I use that technique with the help of puppets on that child, and the child expresses himself that he has been watching Chota Bheem, and he's been watching it for probably an hour and a half every day. Now what really happened as a result of that, the Chota Bheem became his identity. The parents thought it was a servant who was kind of exposing him to all this. But when we actually did play therapy session, we recorded it for the parent. We realized that it was all electronic influence, and amongst all the characters, he had started identifying with this character. So he started using the language of this character. He started expressing himself to the use of this character, and the identification was fused. There was a complete fusion of identity. So this was one of the cases that really turned my attention towards, wanting to tell parents how to work with their children. Today we talk about quality time. What is quality time with children? So quality time, the very definition has to change now. The way we would say quality time would be maybe read out one book to a child, or maybe sit with the child and play. That's not what these children consider as quality time, because they get bored, they are impatient, they have short attention spans, they have diversified interests. How to deliver a message to them, how do we drive home the value system to them, is a way that is going to be different for every generation. If you're going to be working with pre-adolescents, children, let us say from the age of 10 to 12, the technique and the reach you will use is different. Let's come further behind that and let's deal with probably a child who is 8 to 10 years old. It will once again differ. Coming back to the children who are going to school, probably, from the age group of 5 to 8 will again be different, and toddlers will again be different. And what we are going to cover over here is that how your child has a different personality, and that two children can never be alike. Yes, I know you all know this, that two children can never be alike, but we always forget it. So for that, we are going to be doing personality and temperament types, in which we are going to help you assess the child, and I'm going to teach you how to do it for every child. Because sometimes what we may call a problem may actually be a personality. So we begin with understanding the personality, and then we understand their challenges, and then we work with those challenges. So we are going to do personality, temperaments. We are going to be working with the challenges that children face. How do children express anxiety? How do children express sadness? How do you tell whether your child is a happy, bubbly, chirpy child, or your child is actually having some kind of unresolved conflicts that they cannot handle? These all signs, symptoms, along with identification process as well as therapeutic approaches, is what I'm going to tell you. The next issue is education. So we are all concerned so much with education of children, and we should be, because today's day and time, we providing them with the best possible education. How to get them the best out of what we are providing them, and look for any red flags in their academic journey. So we are going to be talking about learning disabilities. We are going to be talking about identification process, the IQ identification process. We are going to be talking about which child classifies as a mild ADD or a ADHD, and there are different subtypes to it. How are you going to check them? How are you going to identify them? Having said that, how are you going to work with them? When this child comes to you, I'm going to give you a 8 to 10 session plan to work with every child, which means you do not book one session with a child because you got to work for 8 to 10 sessions. Often we don't know what to do in those 8 to 10 sessions. So then we are going to use play therapy techniques. And play therapy is by itself, there are stand-alone careers. There are in the US, we have people who are stand-alone play therapists. They have play therapy centers. They have a whole play therapy rooms. I'm going to be sharing the pictures, the toolkit that is required for you to actually set up your play therapy center or a room or a kit or a bag. and work with the children. So we're going to work through stories, through puppets, through fantasy questioning, through gloves, through story narratives. I'm going to tell you what kind of narratives you're going to be working with them. This is educational aspect. So first we are covering personality, then we are covering education. Third, we are going to cover emotional, socio-economic, social, emotional development. So now this is the biggest challenge of this generation. Education, yes, sometimes we can identify where the challenge lies. But when it comes to social emotional intelligence of the children, because of nuclear family setup, the exposure is little. The stimulation is even lesser. Add to it the time taken away through extracurricular activities, a normal social emotional development is difficult for your child to actually find. So, we are going to be teaching you how to initiate, how to stimulate your child to the social emotional development, and it's all going to be done through play therapy. This is what is the basic course outline like. I'll be teaching you the techniques, you will be practicing them on each other. I'll be sharing with you all the videos of some of the children I have worked with, where we have recorded sessions and we have the parents' permission. It was recorded with permission to share it with everybody. And you will be able to see how differently children react to stimuli and what they speak and how they speak and how to get them to talk. So, this is what at the end of it, you will be very well equipped to understand the child's psychology. You will be equipped to understand if there are any red flags any child is showing you. You will be able to understand how to deal with it. And you will be able to understand how to work with the parents and do 8 to 10 session back to back therapy sessions with children. It would be behavioral also. A large extent is behavioral, because when we are talking about any of the discrepancies, be it at the personality layer, be it at the educational layer, be it at the social emotional layer, it will all show up in some kind of a behavior issue. So parents will naturally talk about behavior. Our job is to understand the underlying cause of it, the underlying cause of why a child chooses to behave in a manner which could be probably unpleasant or make them unacceptable to their peers, to the teachers, probably even to the parents at home. And how do we address all these issues? So this is what we are going to be sharing with you. We're going to be sharing 3 case studies with 3 video shoots of the sessions being done with children. We're going to be sharing techniques of how to work with children. We are going to be always supporting you after the class is over. The WhatsApp group that we make does not dissolve. It stays as it is, and we continue to support you. So I am on the panel of many Montessori school where I'm regularly training teachers as well as parents in this entire course. So this is I do it once in 6 months, maybe online, but offline I'm doing it for many Montessoris, addressing many parents. And I do have a huge lot of clientele, which is children clientele, because I'm on the panel of many Montessoris. So lots of children keep coming to us, and that's how we address these issues with real-time cases. And we're going to be sharing all this with you. We're going to be giving you notes, a proper, well-formulated, structured notes for you to run through it whenever you want to. And all the recordings of the workshops will be shared with you all. So this is what we are going to be doing in child psychology and play therapy workshop. Apart from this, we will now ask your questions. If you have any questions, please feel free to ask them now. You can put them on the chat. So I don't want to take too much time. I know it's a evening time, and I appreciate that you all are here at this time. And if you all have any questions, certification. That's one thing that I needed to tell you all. So to work as a child therapist or a holistic coach for children, you need to have, if you're working as a counselor, you need to have your MA psychology. However, if you're working as a play therapist or as a holistic motivational coach for children, you need to only be calling yourself a holistic coach, but the knowledge of child psychology, developmental milestones, the problems children face, and the ways to deal with them. That is very important. So it is not so much of a title based profession as much as it is result oriented. So I have an Instagram influencer who had joined my course, and after that, the way she's applied it, and it's fantastic. Her Instagram pages got filled with content, and she just became even more influencing than everything else that she was doing. And then she started getting lots of children inquiries, and she started working with a lot of children, applying all the techniques. That's one. Then we have school counselors who come. Then we have also parents. Lots of parents have really, really got back to us and said that they now know what should they do in that 1 hour with their children, which is specifically mom dad time, which is especially mom and child time, which is especially dad and child time. They know what to do, and it really, really helps them in fostering bonds. So this is where we are concerned. I will be giving you a certificate from the counseling company of attending a play therapy and child psychology workshop. After this, how you shape up your career is really up to you. But even if you apply it for your own children, you apply it a few children which you work with, you'll be more motivated to work with children. Just a moment, I'll just put this video off. So, yeah. So, friends, let us now generally talk. If you have queries, let us ask queries. Just unmute yourself, ask a question, and let's get into a discussion now. Let's keep it two ways. Yeah, Deepika, Ridhima, Kirti, Prashant, Sangeeta, should be any questions, please ask now. Just unmute yourself. You don't have to come on the video. You can also put them on the chat.
So, ma'am, we are going to work with the behavioral issues also with the kids, right?
Yes, totally.
Yeah.
As I
Because,
said,
hmm,
when the problem is in any of the three spheres, it's in the
hmm,
personality, it's in the parenting, it is in the academics, or it is probably coming from any other influences, the result always will be a different behavior.
hmm,
So
hmm,
behavior is the surface.
hmm.
What lies beneath the surface is what you will understand.
Yes. So, because my major concern is behavior only, means though she doesn't have such behaviors, but because of certain trauma in life, so I think that is impacting her. Means that impact is very strong on her personality. I can feel that. So I really
I
don't know how to get over it.
I will teach you everything. So I'll teach you a
Yes.
10 session techniques. You just
Okay.
need to work with her along the techniques that I tell you.
Okay.
And probably once a week is all that you need to do. But moreover, what you require over here is to understand why that behavior.
Yes, absolutely.
No?
Yes.
So we'll be
Yeah.
working on that.
Yep. Okay. Thank you, ma'am.
Thanks, Sangeeta. All right, guys, next question, please. Kirti, you can put your question on the chat if you like to. Surbi, any questions you have?
Ma'am, I would basically would like to ask does this thing also deal with womb related issues?
Dream related.
Womb, the child, like in they like we say that certain issues, behavioral issues, the child develops in the womb of the mother itself.
Yeah.
So do we also come to know through this?
So, Surbi, what you call as womb related issues could be genetic, transgenetic issues, right? So, we have to look at the behavior. Then we have to look at what is that behavior indicating. Then we have to look at whether this is carried forward in genetics or it is a behavioral issue that the child has developed in response to stimuli. Whatever the behavior is, if it is not neurological and psychiatric, we will be able to work with everything.
So we will be able to identify is it
Yes,
psychiatric or is it
exactly.
until what age we will be dealing with the
12
kids?
to 13.
12 to 13.
Yeah.
Okay. That's the, and above that it comes as adults.
Above that, it comes as, above that, it will come as teenagers. But yeah, I will be giving you a brief up on teenagers along with books to read on teenagers, along with techniques to work with teenager, along with teen psychology.
Okay, ma'am.
Do we learn about gender identity crisis in kids? Yes, we do, Kitty. So gender identity crisis is there. We may have few cases, but yes, we can work with them if they come up and they present it to us or the parent presents it to us. We'll be able to do very good work with it. Any other questions, friends? Hi, Shampika. All right, guys. So I think I have explained the curriculum to you all. I will show you all, share with you all the notes if you like to. Just a quick glimpse of, I just want you all to see what kind of live cases I'm talking about that you all will get to see. Just a moment, give me a moment. I'm sharing with you all something. So now this is a case here. This is the kind of videos you'll get to see where we are working with children. Okay, so this is where we are working with the child for behavioral issues. And we are taking the child through a play therapy session. So you all will get to see such videos, plus you will get a lot of information as well as practice sessions with each and every technique. And if you would like to see the kind of notes we are going to be sharing with you all is also, we'll be running you through everything. I'm just sharing with you all the kind of notes that you all are going to go through. Yes. So these are all the notes that we are going to be giving you, and you're going to be going through each and everything that's there in the notes. It's very detailed, and I'm going to be taking you all through each and everything, and whatever we do is documented here. So if you ever need to refer back, this is there, and your video recordings will be there. So these are all your notes. So this is a combination of theory as well as practicals. And child psychology is mainly dealing with the content part of it, and the play therapy is dealing with the therapeutic aspects of it. This is what we're covering in the workshop. And if you have any more questions, we are good to answer. Otherwise, we are good to wrap up. And I would appreciate if you could all write on the group that I attended the workshop, so that we know how many people have attended and we know how to follow up with you all. Right, friends?
Yes, ma'am.
All right. So no more questions. Shall we call it a day?
Sure.
Yes,
All
ma'am.
right. Okay, guys. Thanks for being here. And let's hope, can you all pick up your phone and message on the group I attended? Ridhima and everyone, can you all
Yes, ma'am.
pick
Yes.
up your phone and message on the group I attended?
Ma'am, we cannot, means it's difficult for us to, because it's only admin can
I got that. I
check.
got
Yeah,
that. I got
yeah.
that. I just changed that. Yeah, you all can send messages now. Just write down, I attended. Kirti, Sangeeta, Surbhi, and Samita. Somebody's name I'm not able to read. It's when. And I'll be sharing the recording, guys. I hope to see you all across. And it would also be great if you could tell other parents and teachers about it. I don't do this often, is the only reason that, I would expect you all to spread the word. So we can just create a kind of awakening among the parent community and the teacher community to deal with children better. And as the word goes around, I'll be able to do this more often. I'm generally basically into metaphor therapy, family constellations, and a lot of other workshops. But I do want every parent to be equipped with this knowledge of this workshop. After this, you all will be able to see why I say that every parent who works with children must have this.
So, ma'am, is it possible to see you one-on-one also?
Yes,
Means,
yes, very much possible. I have a clinic.
so I think where is your clinic?
Where are you from?
I'm from Burili only,
Yeah, so I'm in Thakur village. I have a clinic in
Thakur
Thakur village.
village. No, yes, my one of my friend shared your contact. So,
Okay, okay.
no, yeah, no
Yes,
worries.
yes, you
Okay,
can come in personally also.
thank you, thank you.
All right. All right, friends. Nice meeting you all. Nice talking to you all. And let's hope to be in touch over the course. Yeah.
Yes, ma'am.
See
Thank you
you
for
all.
all
Bye
your
bye.
information and time. Thank you.
Yeah. Bye bye.
Bye bye. Bye.